Hey, what's going on, guys? Jomar Ferrales here, Doctor of Physical Therapy. Today, I wanted to talk to you about how to do a PT evaluation in Spanish. This is going to be part 3, and the reason I'm making this content is to be able to help you learn how to do a PT evaluation in basic Spanish, as well as to be more confident with your Spanish-speaking patients, as well as to reduce that anxiety that you may get when you have a Spanish-only speaking patient. Let me just preface this before I start by saying that this video is meant for educational purposes, and that while I am not a perfect Spanish speaker, many of my Spanish-speaking patients do really appreciate me attempting to speak to them in their native language, even though it's not perfect and even though it is broken. They seem happy about it, and that's all you can really ask for when you're doing a PT evaluation with a Spanish-speaking patient. I just also want to preface too that the evaluation that I'm telling you, the script that I use, is mostly for the home health setting. So a lot of the questions that I do ask are for home care, and also the third part will go over the functional assessment of a home PT evaluation. Now, you may be able to get bits and pieces of the evaluation in Spanish, and you may be able to apply it to acute care or outpatient. However, this is very applicable to the home health setting, okay? Now, with outpatient and acute care, you may be asking more specific questions. So some of this stuff you may be able to use. However, you may be able to find more success with getting a translator app, or just getting a caregiver who speaks English and Spanish, or you can also get a Spanish translator. Now, for part 3, I just want to go over the functional assessment. So in part 1, we went over the introduction, where you stated your credentials, as well as your name, who you are, what your job is. You confirmed the patient with their name and date of birth. And so now in the second video, I went over how to do vitals, how to check strength, as well as how to implement standardized measures that you can do in the home or in an outpatient setting, and also just some questions that I ask the patient when they are at home. Now in part 3, I go over the functional assessment. In home care, the main things that you're looking at are bed mobility, transfers, and how they do with their gait. That's the main thing that you are looking at in a home health evaluation. So in part 3, let's go over bed mobility first. So when you are entering a patient's home, you may find them at the kitchen or in their living room, okay? And you've gone through part 1, you've gone through part 2, and now you're gonna ask them, you're gonna assess how they do getting in and out of their bed, okay? That's a very important part of a home health evaluation. So being able to communicate that in Spanish is equally as important to these patients. And so what you're gonna say is, vamos a caminar a tu cuarto. And all that means is, let's walk to your room. Now this simple question accomplishes 2 things. 1, you see how they walk, and 2, they show you to their bedroom where you are going to check their bed mobility, how they're getting in and out, okay? And so once they're on the bed, in order for them to lay down, just say, acuéstate a tu espalda, okay? So all that means is lay down on your back. And I've had some Spanish patients who maybe are hard of hearing, so they just lay on their stomach. Another thing that you can say simply is boca arriba. That means mouth to the ceiling, or mouth up. So that means that they're gonna lay on their back, basically, okay? And so now from that simple question, you can see how they're doing with their bed mobility, if they're able to lift their legs into the bed. And then the next follow-up question you're gonna say is, a vuelta en esta dirección. So that means turn in this direction, okay? And you can just gesture with your finger the side that you want them to turn to, okay? And 99% of the time, the patients understand when I give them that simple command that they're gonna turn in that direction, okay? And this assesses rolling, another important part of bed mobility. Now, when they're done with that, all you're gonna say is, siéntate aquí, okay? And you're gonna gesture to the edge of the bed, and they're gonna understand that as sitting up, okay? Siéntate aquí. And then you're gonna put your hand up, and then they're gonna understand that, you know, you can sit, or that they're gonna sit at your bed, all right? So from there, okay, the next thing I say is, vamos a caminar a tu baño. That means, okay, let's walk to your bathroom. And so they're gonna take their walker or their cane, or if they're using this as a device, and they're gonna walk to their bathroom. And then you're gonna point to the toilet, because toilet transfers is another important thing. And you're gonna say, siéntate allá. So you're gonna point to the toilet, and they're gonna sit on it, and then you're gonna assess how they do doing a sit to stand from their toilet, okay? Just from that simple phrase, siéntate allá. That means sit over there, okay? And you're gonna point to the toilet. And now you're able to, you've assessed two things already. You've assessed bed mobility, and you've assessed how they do from supine to sit to supine, how they do with their rolling, and then you've just assessed toilet transfers, okay? And now in the home health setting, if you want, you can assess their bath transfers, if they have a shower chair or something like that. And however, you can also leave that up depending on if OT is in, they're gonna assess that as well. But the next thing that I usually do is I assess their gait, and then I'll have them sit at another chair. So you can just say, siéntate en esta silla. So that means sit in this chair. And you'll have a chair set up or something for them, and they'll sit in it. And then that's when you can implement your tug or some other functional measure. And then keep in mind, as they're walking through their house, you're assessing their gait. You're seeing if there's any gait deviations, if there's any things that, you know, that you could document. And so that's basically the functional assessment that I typically go through in a home health setting. Again, in home health, you only have so much time in the home with the patient. You've taken vitals already, you've done all that, you've taken a few history questions, but now your main goal is to just assess them functionally, because that's what's going to lead to the important OASIS questions if you do home health that you have to fill out, all right? And so those are the main things that you're gonna go through. That was part 3 of how to do a PT evaluation in Spanish. Again, guys, I want to just make this much easier for you people who don't understand or are very or are having a hard time speaking Spanish. I just want to show you that as a non-native speaker, it's very easy, and you can definitely do a PT evaluation without having to go through long formal schooling, and you can accomplish it quickly and effectively, and the patient will like you more, okay? I have never had a patient complain to me or tell me that my Spanish sucked. While it's not perfect, 99% of the time they will appreciate you speaking Spanish to them, because think about it from their point of view. If they can't speak English and they're speaking broken English to you, are you gonna tell them that their English sucks? No, you're gonna appreciate it, right? So I think about it that way too, that they're gonna appreciate any type of Spanish that I am attempting to speak with them. And so that's how you have to look at it. That is part 3 of how to do a PT evaluation in Spanish. Again, guys, if you enjoyed this video, please hit the like and subscribe button below, and I will talk to you guys later.